Okay, we've started recording.
Mhm.
Okay. All right. So, hello and welcome to the second episode of Beating with the Facts. My name is Sonakshi. If you don't know about me, I'm on a mission to raise awareness on many social media trends, activities, habits, and diets that can be harmful to an adolescent's cardiovascular system or mental health. Today, I'll be interviewing my very own pediatrician, Dr. Shobhana Sundaram, a remarkable doctor who runs a pediatric and adolescent care here. Dr. Sundaram, why don't you talk a little bit about yourself?
Hi, everyone. Who is this going towards? Just your.
Oh,
Um,
just my YouTube channel. No one else. No.
oh, okay. Hi. So, for people who don't know me, I have my own private practice. I've been a pediatrician for the past 30 years, and very much involved in taking the routine care of my patients. So, I think Sonakshi is interested in knowing more about the day-to-day um, nutrition, awareness, how to take care of yourself. Is that right?
Yes.
Yeah.
Yeah, so let's actually get started. Okay, so I want to first talk about specific to pediatrics because I've been hearing lots of doctors that are, more so for adults, but I want to hear more for pediatricians because my target audience is teenagers like me.
Mhm.
So, on the internet, there's this trend out there where people eat Tide Pods, and obviously it's not a good idea, but in terms of how it actually affects a child system, can you tell us specifically how or to your best efforts?
So, first of all, it is poisonous. Those are all chemicals that we are putting into our body. It is not meant for internal consumption.
Mhm.
So, you can have, depending on what the contents are, it can affect you in various ways. It can even be life-threatening. Okay. Um, More so, I have a lot of concern about like I don't know if you know about it. At one point, there was a eating cinnamon powder.
Yeah.
That was a trend too, remember? But
Mhm.
it's a very fine powder. So as you're eating, you can get inhalation of it, and that could affect. So kids have to be careful about what they see on the internet, what they read about, and be more cautious about trying those things.
Mhm.
Yeah.
Yeah, and I also want to talk about, and I don't know, I've heard of, now I want to go to a general audience perspective. From what you've learned in general medicine before you got into your subspecialty, how can drinking, so alcohol, how can too much of it affect your heart? So from the previous doctor, he was an electrophysiologist. He
Mhm.
told me that your heart apparently, I don't exactly remember, but it has irregular rhythms. It starts having irregular rhythms from too much consumption and stuff like your liver also starts
Alcohol
failing.
mainly affects the liver.
Yeah.
So, like binge drinking, like if you suddenly consume a large amount of alcohol, it leads to actually very low blood sugars. So, hypoglycemia is one of the immediate effect of it. But long-term alcohol consumption first affect your liver.
Uh-huh.
Okay, it causes cirrhosis
Okay.
of the liver, which is a chronic condition, causes elevated liver enzymes and eventually liver failure.
Okay.
Okay, so more than the heart, alcohol is more of a liver issue.
And is this an issue that is seen with teenagers? I don't think so, right?
No, cirrhosis is over long-term alcohol use,
Okay.
right? So for teenagers, it's most of the time is binge drinking. So I know many kids end up in the hospital losing consciousness, and that is because of that low blood sugar it leads to.
Okay.
Okay, and the associated factors that can go along with the alcohol, like if you're smoking, if you're doing other drugs, they can adversely affect you both working together.
What are some kinds of conditions that kids our age have if they do those activities?
Like, are you talking about alcohol and drugs?
Yeah, alcohol and or drugs.
Correct. It can cause lots of consciousness, associated head injuries that come with it, and inebriation. And then I don't know if you know about this. Some of the drug use, like for example, if you are someone who could be prone to schizophrenia or other mental health condition, the drug use can tip you into that.
Oh, so it
Okay.
causes
It
mental issues as well.
over period, yes, it can do that. So but at the same time, kids who do drugs may sometime go into drugs because they're already having depression, anxiety, and other issues, and that could be one way of them trying to get over it, right? So it can be both ways.
Okay.
Okay, but most of the time kids do it because of peer pressure,
Mhm.
wanting to feel cool. So we should always have that constant conversation about what is okay, what is not okay.
Yeah, I always think
Mhm.
like, okay, you'll be cool now by doing so and so that your friends are asking you to do.
Mhm.
But 20 years from now, you probably won't be as cool because you'll regret what you've done.
Exactly.
So that's kind of what I keep telling myself and others. So and you mentioned like drug usage. Can it happen from an overdose of like regular pills that people take, such as vitamins or
Of
like
course.
Tylenol?
Tylenol, simple Tylenol. Yes, you can overdose on Tylenol. Absolutely. You can overdose on any of your routine, some of the vitamins too. For example, you know the water soluble and fat soluble vitamins, right? So the fat soluble vitamins A, D, E, K, you can overdose on those, but those overdose are not that life threatening. It can cause problems over a period of time. But simple Tylenol, you can take Tylenol and overdose, and it can cause acute liver failure.
And what about Benadryl? I haven't heard of that, but apparently people overdose on that as well to help them fall asleep.
Correct. It's not overdosing on Benadryl, but Benadryl side effect is sedation. So people do take it. But if you take too much of it, it can cause seizure.
Seizures. Okay, so like I thought seizures were like a genetic thing, but it's not.
Oh, no, no, no. It can be triggered by so many other reasons. You can have seizures from so many other reasons. Remember, we talked about alcohol. So
Hmm.
if your blood sugar goes so low, hypoglycemia can trigger a seizure too.
Okay.
Yeah. Epilepsy
Um,
is just one of the reason for seizure, but seizure can be caused by many other things too.
okay.
Yeah.
And I want to talk about another trend that's going around on TikTok. Well, it's not that recent, but it was pretty recent. It's called girl dinner. So,
What is it called again?
girl dinner.
Okay,
So,
I've not heard of that.
yeah, so basically there's like there's this like stereotype that usually girls are small or petite and stuff like that and they have to eat that way, so
Mm.
their dinner can be like their dinner or their eating portions are very little, so like
Mhm.
very meager portions, like it could just be like crackers or like maybe like half a cucumber for dinner.
Mhm.
So how can you, with your knowledge, explain to my audience that this is definitely a very bad idea?
Correct. So you are talking most about the eating disorder
Yeah.
issues, right?
Yeah.
So one, there is a lot of body image issues with the teenagers in general, and that has gotten aggravated so much with all the social media use, right? So what do you see on TikTok? What do you see on Facebook? Everybody posting their best version of themselves, Snapchat, and it may not even be the true how they feel or what they see, right? It's a lot of modified pictures and everything, correct? And people want immediate effect, right? You don't want to do your healthy eating, you don't want to do the exercise. I want to look good like right now. Okay. So that is leading to all these attempts to try fixing things very quickly, And as you know, there are so many medications that have come in the market helping you to lose weight, like Ozempic and so on. So overall, this has led to consciousness about body image issues. Okay. But my advice to my pediatric patient is always the same: whether you are thin, whether you're normal weight, whether you're overweight, you are still growing. Your body needs the nutrition, and you are learning to eat the right way so that you can sustain that for the rest of your life,
What
right?
are some nutrient like nutrition or like deficiencies that you see? Because like there's like picky eaters out there as well. Like what are
Mhm.
some deficiencies that you see commonly?
Very common. So iron deficiency anemia, right?
I
That's
have
the
that.
most common. Okay. But over time, it is, your protein deficiency. We don't see the full-blown malnutrition here, but anorexic people, your body slowly starts shutting down. So those things can affect your heart.
Mhm.
Okay. You stop having your periods, your body shuts down. Non-important one, so period is not that important, so you stop having periods, then eventually it causes electrolyte abnormalities. It can affect your heart, it can cause arrhythmias, right? So you cannot skip meals, you still have to eat a high protein, high fiber diet. Avoid sugary things, avoid junk food, avoid eating out too much, right? But your body still needs nutrition, you still have to eat in moderation, and exercise.
Yeah, so here's the thing. Yeah,
Mhm.
again, going back to picky eaters, if I don't know if you've had patients like that, but if you did have a patient like that, what kind of diet would you prescribe to them knowing that, they don't they're not willing to eat these products and those
No,
food?
then it becomes a mental health issue, right? Like I told you, my advice is the same. Okay. You eat all your food, cut down on carbohydrate, eat more protein, more fiber. Fiber comes from your fruits and vegetables. Fruits have carbohydrate, but it comes with fiber. So your body deals with it in a better way, right? Avoid juices, avoid sugary drinks, avoid unhealthy, oily, fried food. Don't overeat, right?
How
So
much
don't.
exercise do you like prescribe like do you recommend in a day or in a week for like a busy person or like a school, student?
So ideally, you should exercise every day, but if that's not possible, at least 5 days a week, you should spend 1 hour every day, do a bit of cardio, do a bit of strength training or body exercises, because some of them are very young and I don't want them using weights or anything, but you can do body exercises to strengthen
Why
your
why
muscles.
are weights bad for young
No,
people?
it's not that weights are bad. Low weights are okay. Repetitions are more is okay. But if you try to do very heavy weights, you could injure your joint and your joints are not fully developed. So it can affect the growth plate.
Okay.
Yeah.
And then speaking of unhealthy food,
Mhm,
you've probably heard of the red 40, the dye, right?
mhm,
In foods like Takis and like Flaming
mhm.
Hot Cheetos. Um, like have you ever seen a case that is very, very you know, how do you say it? Like in the level of like normal to very abnormal? Have you ever seen a case where a patient has consumed so many artificial preservatives, colors, dyes that it actually starts affecting their thing?
Not really. To answer your question exactly, no. But some of my ADHD patients, parents say like they see when the kids take sugary drinks, they seem more hyper.
Mhm.
Um, Behavioral changes they see, and the same thing they see with dye products too. Not everyone, but some do.
Um, and then um in terms of adults now, I'm talking people over 40, 50-ish.
Mhm,
What kind of since like I'll talk about my parents or just in general my general family, they're restricting themselves on food because they tell me that, oh, we're at this certain age where we can't have too much of cholesterol high foods because, they're being cautious. Um, but is there an alternative where can people above 40 still have like the same diet as that of a 20-year-old if they're active?
See, once you turn 35, 35 to 40, your metabolism slows down.
Okay.
Okay. So older people need more of the strength training so that your muscles are activated and strengthened,
Mhm.
and you can burn more calories that way. So because the metabolism slows down and because you don't burn as much calorie, the intake has to be under control,
Mhm.
right? So to answer your question, when you compare a 20-year-old and a 40-year-old, if you're not physically active, if you're not doing strength training, maybe eating the same amount of food or same type of food, your body responds differently if you're older
Mhm.
because of the hormonal changes. Men, women, also there is a difference. Once you hit menopause, you tend to put on more central fat,
Mhm.
okay, because of the low estrogen. So there are a lot of changes. There is a difference.
Mhm. Uh, have you, so like when I think about high cholesterol, blood pressure, those problems
Mhm,
or
mhm,
like what's it called where you have to put a balloon inside someone? Oh, coronary artery disease and stuff like that. Have you
mhm.
ever seen, other than diabetes, have you ever seen like those kind of conditions in a young person? Like, are they genetic at all?
I have children who have high cholesterol. We do see it. But the coronary artery disease, no,
Okay.
not at this age. But what we are trying to do at this age is develop healthy habits so that you don't end up with those diseases in your 30s and 40s. These things can happen when you're 70, 80-year old, but we want to prevent that in the young adulthood.
Hmm.
Yeah. So we don't see it at this age, but we want to prevent it.
Okay.
Cholesterol, we do see though. Pediatric patients have elevated cholesterol.
Sorry. Is the elevated cholesterol, is that primarily because of their dietary choice or is it genetic?
It can be both.
Oh,
Many of my patients have diet and lack of exercise. When they change their diet, eat healthy, exercise, next year when we do it, levels improve.
okay.
Mhm,
And when it comes to also uh when I see people online trying these diets or trying these workout routines, I've seen many other people that are reacting to those videos and they're like, "Oh, this is a really hard intermediate exercise and you should ease into something, warm up into something." Like for example, when before you workout or before you start running a race, you're supposed to warm up, or after your race, you're supposed to warm down.
mhm.
Um, but people like me, sometimes, like after I'm done swimming, I do not warm down, and it takes a toll on my body, but I don't know exactly why. Can you tell us like why warming up and down is important for,
Yeah, warming up is important to prevent injuries.
okay.
Basically, like, so without any warm up, you start running, your chances of causing sprains, having pain in the muscle and everything is uh, increased. Okay, so warm up is definitely important.
And then, a lot of kids my age, they take, sports like volleyball or basketball and stuff like that. When it comes to sports that are very high impact, do
Mhm.
you recommend like a certain like how hard they should work at it? Because I've heard of like athletes that have worked so hard at like a sporting event or at a certain sport and then suddenly they get this injury and they can't do it anymore. So what do you have to say about like that?
I didn't understand the question.
As in
Like sports injuries?
yeah, sports injuries. Do you treat that when you at like pediatrics or is that a specific sports doctor?
No, no, simple injuries like sprain and everything, we do treat it. Um, but of course, broken bones, they have to see ortho. Sometimes kids get stress fractures, which
Okay.
is a overwork injury. So if you're doing too much activity without proper nutrition, you can get fractures without a fall, and that's called a stress fracture.
What are the most common areas you can have them in?
It can be in your, the feet, bones, or your shin area. Very common.
Do you need a cast or like any crutches?
No, so many times X-rays don't show. Then you may need like a nuclear medicine scan to show it. Then the treatment is mostly rest and recovery from there. Yeah,
And
you may want to read about it. Stress fracture,
risk
it's called.
factors. I'll write
Yeah.
that down. And
Mhm.
also,
It's an
what would you
overuse injury.
overuse injury?
Hmm.
Okay. And last question before we start, wrapping up a little. Uh, Geez, I forgot my question. Um, yeah, so since we were talking about stress, a lot of teenagers, especially in high school, they take the burden of college, they're like, future things like college or extracurricular activities, schoolwork. Um, how bad can the burden be on a person to like, is there a condition like that other than just like plain stress and mental, you know,
Hmm.
exhaustion? What other kind of things can a person get?
No, it can cause depression and anxiety mostly,
Okay.
right? So my recommendation would be you do what you can do, but don't compare yourself with others. Just because some other kid is doing like 5 or 6 AP courses and so many other activities, if you are not able to do it, don't try to copy that. You
Mhm.
should do what you can do and do your best at it. Be your best at it.
Mhm.
Yeah,
Yeah.
you really don't need to do so many activities. Do one or two activities and try to be really good at it,
Yeah.
because your health, mental status, mental health is important too. So
Mhm.
don't compete with others, compete with yourself.
Yeah. And last question, just a bonus question since we have like a
Mhm.
minute or two. If you had to choose a different subspecialty to work on for a day, which one would you choose?
Different subspecialty. I used to love surgery.
Surgery.
Yeah. But
Okay.
now, if you ask me to do surgery, I may not do it. I love pediatrics.
Yeah. All
Yeah.
right. So I'll just stop recording. Thank you so much for joining me here on the second episode of Beating with the Facts, and I'll see you in the next.
That